Hi everyone, my name is Vanessa Hampshire and I work as a diabetes specialist nurse, and I want to welcome you to this presentation, your diabetes microvascular check-in. What are your tests trying to tell you? This will take less than 10 minutes of your time and is aimed at any individual with an underlying diabetes diagnosis. The aim of this presentation is to try and simplify why you're asked to have these tests when you attend your diabetes checkups. Living with diabetes can sometimes feel overwhelming, and there are a lot of tasks that you already need to do when managing diabetes. And alongside this, you will be asked to attend a review with your GP or respective healthcare professional who will ask for certain tests and investigations. These will include blood tests, urine tests, foot checks, and eye checks. Often, this can be without a proper explanation or with an explanation that uses too much medical jargon. This can make the whole process confusing and might make you not want to engage as a result, especially when you feel absolutely fine. The big question is, what do they actually tell you about your health? And why are they needed? Today we're going to break it down with a little help from these characters. We have Rory the retina, Keith the kidney, and Nina the nerve. So let's get started. In our body, we have microvessels, which are tiny blood vessels in the circulatory system. They deliver nutrients and oxygen to the tissues and remove waste. So what's important to remember here is that healthy microvessels keep Rory, Keith and Nina happy. However, as you can see here in the blood glucose picture, prolonged high blood glucose levels can affect these microvessels, making them stiff, leaky or even clogged, which can lead to restricted blood flow and tissue damage. This deterioration can happen without symptoms, so you won't necessarily get the warning signs in the initial stages. You might only get symptoms when there is more prominent damage and is therefore more advanced. The good news though is that regular check-ins can catch these potential problems early. First up is your HbA1c. This is your 3-month average blood glucose level. It helps show how much glucose has stuck to your red blood cells, which have a lifespan of around 3 months. It provides a long-term picture of blood glucose control, unlike a finger prick test, which is a snapshot in time. And although a continuous glucose meter can provide a more detailed picture, a HbA1c blood test is always needed. A general goal for many adults is around 48 millimole per mole, ideally less than 53 millimole per mole, as high glucose levels can damage the tiny vessels in the back of the eye before you notice any vision changes. Your personal target may be slightly different, and that's where it's important to liaise with your healthcare team to determine the best goal for you. And like Rory says, a healthy HbA1c helps keep him happy. Next up is the urine albumin test. You might know this as urine ACR or just ACR. Your kidneys have a delicate filtering system. A healthy kidney keeps proteins within your bloodstream, but when damage starts to occur, protein albumin begins to filter through, which is then passed in your urine. This test helps to detect any issues in your kidney at an early stage, because once again, this process can go undetected without having this urine test, and is often reversible when it's caught early. Keith has a good understanding of this. Think of him as a coffee filter. Once holes start to form, the coffee grounds sneak through. This is your urine ACR test. It helps to catch these holes early so we can try and fix it before it progresses and deteriorates. Test number 3 is an EGFR blood test. This measures how well your kidneys are filtering waste from your blood. More specifically, it measures the level of creatinine, a waste product from muscle and protein breakdown, in your blood. When your kidneys are filtering well, they filter creatinine out of the blood and pass it through the urine. A healthy EGFR is above 90. If your EGFR is slightly lower, this can be normal with ageing, but a consistent drop can be an indicator of chronic kidney disease. Like Keith says, try not to worry because it's about the overall trend, not just a standalone number, and your healthcare professional will take this into consideration. Test number 4 is your retinopathy screening. This is a painless photo that checks the tiny vessels in the back of your eye. Quite often, people can display no symptoms when early damage has begun. So catching these symptoms and catching changes early helps prevent vision loss. Like with anything, the treatment options available work best when it started in the earlier phases, so it's important to get it checked. Since the 1st of October 2023, in the UK, for individuals at low risk, meaning that you've had 2 consecutive clear screenings, then your eye screening can be as little as 2 yearly. However, if there are signs of deterioration, then this can be more frequently, whether that be annually or 6 monthly or 3 monthly. It really depends on how your previous appointment was as to when your next appointment will be, and this is done in your best interest to closely detect further changes. Like Rory says, this simple picture can show any leaks or swelling long before you even see any changes in your vision. And finally, let's discuss the importance of our foot checks. When you attend your care appointment, they will test your sensation with this monofilament device that you can see in the top right of the screen. This helps test for any potential nerve damage. They will apply this monofilament to specific points on your foot to test if you can feel the pressure being applied. If you can't feel this pressure at one or more designated sites, it can show a loss of protective sensation. Your healthcare team will also look at your blood flow and assess to rule out any hidden cuts or pressure spots. Raised glucose levels can affect the nerves first. This can often be without pain, so these checks are vital to prevent complications. And like Nina says, your nerves like to be kept happy by maintaining stable blood glucose levels, checking your feet regularly, and staying active. Well, each test and examination we have discussed within this presentation, HbA1c, urine albumin, EGFR, retinal screening and foot checks, they all look at a different part of the microvascular system, and that's what this all means. So adding this all together, they give you and your healthcare team a detailed picture of how your diabetes may be affecting your body on the inside. It's important to not look at these tests as problem finders, because these tests give you the power to protect your eyes, your kidneys and your nerves and prevent its associated complications of retinopathy, nephropathy and neuropathy. It's our way of proactively keeping Rory the retina, Keith the kidney and Nina the nerve happy, and we can do this before the symptoms start. So I'd like to say thank you for taking the time to listen to this presentation, and I hope it has helped clarify why these tests are important for managing your diabetes. Remember, your microvascular buddies are cheering you on every step of the way. Show this video to someone else who may be living with diabetes to help raise awareness and understanding around this long-term condition. And remember to take care of yourself and please book your diabetes check today.